Our next speaker will be Dr. Paige Pennell, who is chair of UPMC's Department of Neurology. She's also the Henry B. Higman Professor of Neurology at Pitt. She has many accolades. For example, she's earned the Senior Faculty Mentor Pillar Award while at Harvard's Brigham and Women's Hospital. She was also the Hedwig van Amergen Executive Leadership Academy of Medicine Fellow, just to name a few. Dr. Pennell will describe her recent journey to UPMC and how she aims to make an impact on both access and positive outcomes through innovation. Dr. Pennell.
Thank you. I do have a few notes. As I was saying, I would be more comfortable speaking to a room of 1,000 neurologists than you. So I do have a few notes. Unlike Dr. Conti, I can't wing it. So I thank you so much for coming out tonight and allowing us to share our passion. And so with that, I want to just give a little bit of background why I'm here. I moved from Boston, the Harvard system, about a year ago. But why did I even go into academic medicine? Academic medical institutions like UPMC, partnered with University of Pittsburgh, they are magical places. They truly are. So there's a lot of ways to practice medicine, but we are so fortunate to be in that setting where we can shape and help the next generation of physician scientists who come behind us. And it's also great working with those coming behind us because they challenge us and they make us think and not just accept clinical dogma. The other reason why academic medical institutions are particularly magical to me are that those of us who go into medicine, we're scientists, right? So we like science, otherwise we would never be able to get through the grind. And medical school teaches you how to apply the science, how to apply the data and the research to the patient in front of you. But at academic medical institutions, we can actually not only apply the science, we can create the science. We can generate the hypotheses. We can figure out how to address the gaps and how to come up with the evidence. And that's what I've loved about my career so far and what I've been able to do through clinical research. So when I see a person in front of me, I can go to the medical literature and say, oh, here's how we should treat them, but oh, the information is not there. What are the gaps in our knowledge base? And this is something that really came to light when I was a faculty initially, a particular area that just did not have the information to allow me to practice evidence-based medicine. It did not allow me to counsel the person in front of me who was faced with life-threatening decisions. I could not tell them, here, you can do treatment A, and you have this percentage of this. I didn't have the information. And so from that, I designed the study. I got the funding. I got donors to help with that research so I could come up with the information to allow myself, but more importantly, to allow physicians throughout the world to actually take this knowledge and change the course of care for the people in front of them. So it allows me to impact and hopefully deliver great medicine and help improve the life in front of me, but also have a much bigger breadth. And so that's why now I got out of my bubble. I was in my little research bubble of what I was doing and really started looking at chair positions because where we are in neurology right now, it is phenomenal. And of course, I'm a little bit old, but when we look at what's changed from when I started out, we have so many options now. We have so many different diagnostic strategies, and our therapeutic options right now are exploding. Before, we had aspirin. You know, you had a stroke, take aspirin, maybe you won't have a second stroke. Right now, it's amazing all the different things we can do, all the drugs that are out there, all the devices, the surgeries working with neurosurgery, and we're just on the brink. So it used to be we would prevent secondary stroke. We would treat the symptoms of Parkinson's disease. We would treat the symptoms of multiple sclerosis. But now we're at this brink of we're actually able to modify the disease and change the disease trajectory of a person suffering with neurologic disorders. And we're even moving further back in that pipeline where we're able to actually start thinking about preventive strategies. So I was so motivated to come to UPMC because I think this next generation of academic neurologists are going to be pivotal to make those changes, make those discoveries, and change the lives of persons. I am so jealous of them because they will see so much in their lifetime that we're finally getting to the point where we can set the stage. And with that, we need to really foster that scientific inquiry among physicians going into neurology. UPMC, the other thing that I really liked about coming here versus staying in Boston or going to other chair positions is I think it's one of the unique places where you can actually take the whole translation. You can go from bench neuroscience. Our neuroscience at Pitt is unbelievable across so many different departments and really cutting edge. But then you can take that bench science and bring it to the patient. You can bring it to new therapies. But then also with the large network of UPMC and the healthcare plan, we can actually look at population health. So with some research, you can say, okay, you have 50 patients, now 3% will do this, that, but we can actually look at how does this actually change population health. And so one of our real challenges in neurology as we're having so many more options is access. And as our population is aging, there's so many more strategies of how we can help people. So that's another way where UPMC is helping bringing the innovation to access as well. We've hired full-time teleneurologists. We have also partnered with geriatrics and with psychiatry of training people in the community, especially the underserved community, to identify early cognitive impairment, so mild cognitive impairment that will be eligible for some of these breakthrough medications that are coming out to slow down the progression of dementia. So we have a lot of challenges. I'm doing a lot of recruiting. We have a lot of neurologic need, but at least we're also looking at different models of care so that we can help to address that need. And hopefully, I really am excited about what the future brings for us. Thank you for your attention.